Okay, people. Hi, Monique. Hi. So I put a post up this morning. This is Dr. Sharon. I put a post up this morning on heart disease, and I've gotten literally, since putting the post up, probably about 8 questions on what your cholesterol should be. So I'm in Uber on my way to the airport, praying to make this flight, this quick in and out, and decided, hi, Paul, to come on Facebook Live, which is, so I'm moving and hope I make this flight. Y'all pray for a sister. Got a lot of questions. Heart health, heart disease remains the leading cause of death for everyone worldwide. Leading cause of death. And so while it's great for us to always talk about the cancers, and you all know I do a lot of work with the American Cancer Society. We'll be doing some work with them later on this week. Heart disease is actually the reason why most of us will leave this world. I have been in meetings, and if this is you, I'm not throwing shade at all. It's about education, where people have said, well, I don't have heart disease, I have high blood pressure. High blood pressure is related to heart disease. So when we talk about heart disease, we talk about anything related to the heart. Most of the time, when we talk about heart disease, we're talking about having a heart attack, having some clogged arteries, high blood pressure, even stroke in some instances is related to plaques in the heart that break loose and go to the brain, etc. So it really is important for us to keep our heart in check. Other things like a murmur. Many of us have a low-grade murmur. Well, if you're anemic, you may have a low-grade murmur. A murmur is simply, the heart is lub-dub, lub-dub. That's the sound that your heart makes. When the doctor puts the stethoscope here, they hear lub-dub, lub-dub. A murmur is lub-dub, whoo, lub-dub, whoo. It's a little bitty extra sound. If you have what's called low flow or anemia, you often will have, hey X, you often will have another beat. And you can have things called AFib, where your heart doesn't beat in the lub-dub fashion, or it's irregular. Now, when you see people grab their chest, fall out with sudden heart death, they have gone into what we call a fatal rhythm. And that's why it looks so dramatic on TV. If they grab their chest, fall out, and someone gets on the chest and pounds the chest, that your heart is electrical. So the electricity in the heart has gone off. But that's not really what we're talking about. That's something that, you can get VTAC, and that's bye-bye. I mean, I'm just saying, that's, unless we can shock you, but I'll do another whole piece on that. Hey X, I'm Paul and Sherelle. So now, and I've got a lot of questions. They look at my post. I talked about heart disease and what you can do. Let me tell you what your number should be, because and we need to be real about it. Your blood pressure should be less than, everybody say less than 120/80. One of the things that happens, particularly in minority populations, are physician assistants, nurses will say, oh, you're 130/90, that's good for you. I want to be at goal. My goal is less than 120/80. I talk about this all the time. And the other part is, if you have high blood pressure, please invest in a blood pressure cuff. Go to CVS today. You should have one in your house anyway. Period. Get a blood pressure cuff and monitor whether it's the wrist. I actually don't particularly like the wrist as much as I like the ones that go on the arm, so that you can get your blood pressure checked. Prevention, and knowing your numbers. It is not good enough to go to the doctor once or twice a year and get a blood pressure check, and that's it. Okay, so that's a sidebar. So hypertension, also known as high blood pressure, your blood pressure should be less than 120/80, and that's what you should work for. How do you get those numbers down? Naturally. Naturally, number one, salt is your enemy. And hey, Brian, salt is your enemy. Hi, homegirl Terry, salt is your enemy. If you are African American, salt is really your enemy. There is something genetic.